I'm Alexandra Nelson, one of the students in our BSc 546 class, and I will be discussing hepatitis A today. Hepatitis A is one of the 5 hepatitis viruses that exist out of hepatitis A, B, C, D, and E. So I'm just going to go into the pathogenesis, epidemiology, vaccines, existence or lack thereof of treatments, so on and so forth, throughout the rest of this presentation. So just to give you a little bit of an introduction, hepatitis A virus is caused. Hepatitis is caused by the hepatitis A virus. It's a member of the genus Hepatovirus and the family Picornaviridae, which is the picornaviruses. The structure, hepatitis A was first isolated in 1979. It's a small icosahedral unenveloped particle, typically ranging from about 27 to 30 nanometers. Prior to isolation, or prior to the point that we were able to isolate hepatitis A was considered jaundice, acute catarrhal jaundice, and campaign jaundice. We didn't have a link for why people were having this onset of symptoms as well as jaundice until we were able to isolate the virus. So just a little background on hepatitis A virus. Humans are the only known natural host. It is stable at low pH and inactivated at high temperatures, so temperatures greater than 185 Fahrenheit. It's also inactivated by formalin and chlorine. The virus pathway, it's replicated, which I will go into more detail also. It is replicated in the intestinal epithelium. Viremia transports the virus to the liver, and secondary virus multiplication occurs in the hepatocytes and the Kupffer cells. And then it is infectious hepatitis A. Pathogenesis. For the pathogenesis, the virus enters the body by ingestion. It's acquired by the mouth via the fecal-oral route, mainly, or intestinal infection. The virus then spreads, likely by the bloodstream, to the liver where it replicates. That's why a lot of the discussion around hepatitis A virus is about the health of the liver, existing conditions that exist with the liver, mainly because all of the replication occurs in the liver. After 10 to 12 days, the virus will be present in the blood. It then is excreted via the biliary system into the feces. It's important to note that the concentration of the virus is magnitudes higher in the feces than when compared to the blood. At onset of clinical illness, the virus excretion begins to decline, and just as a note, children may excrete the virus longer than adults. Throughout this presentation, I'm going to try and bring out the differences in children and adults, just because children seem to manifest the illness in a very different way, or at least noticeably in the clinical presentation a different way. So to get into the epidemiology, I'm going to break it into a few categories so it's easy to understand the main factors surrounding hepatitis A virus. Looking at occurrence, it occurs throughout the world. It's highly endemic in some areas, particularly Central Asia, South America, Africa, Middle East, Asia, and the Pacific. This also, which I will touch on, has a lot to do with the sanitary conditions of these areas, dealing with like water sanitation and ingestion of the virus. A lot of developing countries have less sanitation or less ability to control feces, possibly tainting the water supply that many use for their daily life. Looking at reservoir, the only known reservoir is humans. There's no known insect or animal vectors. When it comes to transmission, like I said earlier, it's acquired primarily through the fecal-oral route, usually by person-to-person contact or ingestion of contaminated food or water. It has also been transmitted on rare occasions by transfusion, since, as we said, the virus is present in the blood during illness prodrome. However, that's a lot less noted in practice. Continuing on with epidemiology, temporal pattern, there is no appreciable seasonal variation. This is important when trying to understand a virus and how to deal with how it covers the rest of the world. And communicability, the viral shedding persists for 1 to 3 weeks. Infected persons are most likely to transmit for 1 to 2 weeks before onset of illness. Risk decrease after and is minimal after onset of jaundice. So you're shedding this virus mainly all during the portion of time that you don't know you have the virus, which is very important for us to know and understand as we begin to see, as when we were trying to find ways to treat the virus and help deal with the symptoms that people had. There are specific persons that are increased risk. A lot of it has to do with food, sanitation, like I mentioned earlier. But just to go through the increased risk persons real quick, international travelers, again, dealing with things like that. Close contact with an international adoptee from a country of high or intermediate endemicity. Men who have sex with men, person who use illegal drugs, persons who have a clotting factor disorder, persons with chronic liver disease, kind of like I mentioned earlier. This largely has to deal, your ability to get through the virus largely has to deal with the health of your liver. So when we talk about treatment, which there isn't treatment, the main preventative or help in dealing with the disease, the virus, is working on the health of your liver. So you're advised by your provider to drink less alcohol and get lots of rest. Therefore, when we say persons with chronic liver disease, they already have an existing condition that makes it difficult to get through the course of the virus. Further persons at increased risk include healthcare workers, childcare centers, sewer workers or plumbers, food handlers, and persons with occupational risk of the like. So, it wasn't until 2011 that a formal case definition was approved. The clinical description for acute hepatitis A is an acute illness with a discrete onset of any sign or symptom consistent with acute viral hepatitis and either jaundice or elevated serum alanine aminotransferase or aspartate aminotransferase levels. So these are your elevated ALT and ASTs. Elevated ALTs and ASTs are liver markers, so when they're elevated, you see that there's something going on with your liver. Diagnosis of hepatitis A specifically requires the presence of HAV-specific IgM antibody. This is because a lot of the hepatitis viruses present in a similar way. So for us to determine hepatitis A specifically, the antibody needs to be present. So going into detail of clinical presentation, incubation period of Hep A is approximately 28 days, but it can range from about 15 to 50 days. Likelihood of symptomatic illness is dependent on age. So, this is the big thing. In children younger than 6, 70% are asymptomatic. However, in older children and adults, Hep A is usually symptomatic with jaundice occurring in more than 70% of patients. Clinical illness typically does not last longer than 2 months, but it has been shown to last up to 6 months due to virus relapse, which we'll cover in a little bit. Virus can be excreted during that relapse portion of time. So for the illness, like I said earlier, it's not specific for Hep A. A lot of the hepatitis viruses present in the same way, but looking at clinical illness presentation, you have abrupt onset of fever, malaise, anorexia, nausea, and abdominal discomfort. Within a few days to weeks, you will then note dark urine, and pale stools can also be observed. This is followed then by the clinical presentation of jaundice. Looking specifically at physical exam findings, signs for hepatitis A include jaundice, scleral icterus, which is basically jaundice of the eyes, hepatomegaly, enlarged liver, and right upper quadrant, so right upper abdominal tenderness to palpation. Less common findings also include splenomegaly, so enlarged spleen, and extrahepatic manifestations. So those are manifestations not outside of the liver, such as skin rash and arthralgias. Arthralgias are basically joint pain. Clinical presentation with underlying conditions. So just to note how existing conditions are affected by those that contract Hep A. Pregnancy. Acute Hep A has been associated with increased risk of preterm labor and gestational complications, so it's important that we make sure we're aware of those who are pregnant and then also have Hep A. There has been no specific disease manifestations described for immunocompromised hosts. And lastly, there has been shown to be fulminant hepatic failure, which is the development of severe acute liver injury and impaired synthetic function. This typically occurs in individuals that are older than 50 years of age, and those that have other liver diseases already, so other chronic liver conditions that exist, such as Hep B and Hep C. As I kind of mentioned earlier, there are complications that exist with acquiring Hep A. There are 3 known: cholestatic hepatitis, relapsing hepatitis, and autoimmune hepatitis. So just to go through them really quick, for cholestatic hepatitis, it's prolonged cholestasis characterized by jaundice lasting longer than 3 months. This has less than a 5% prevalence rate, so it's not highly seen, but it's mainly characterized by marked jaundice, pruritus, which is itchiness, fever, weight loss, diarrhea, and malaise, with labs notable for elevated bilirubin and alk phos. There's also relapsing hepatitis, which up to 10% of patients relapse during the 6 months of acute illness. However, the good thing to know is that duration of relapse is usually less than 3 weeks, so that's less than the initial virus course. There's lastly autoimmune hepatitis. So this is a chronic hepatitis characterized by hyperglobulinemia, the presence of circulating autoantibodies. So these are antibodies that are attacking, they're like mislabeling your organs as targets, and inflammatory changes on liver histology. So these are 3 complications that can exist with Hep A, but they're not largely seen, but it's good to just note things that can exist. So looking at all of this and how we discussed the treatment is really just taking care of yourself, staying rested, not drinking, anything that can help with the health of your liver, a vaccine was produced. There are 2 inactivated vaccines available, so virus inactivated vaccines available, both monovalent. They are known as Havrix and Vacta. The main difference, Havrix is produced with a preservative, while Vacta is not. So just a little rundown of how the vaccines are produced. A cell culture adapted virus is propagated in human fibroblasts, purified from cell lysates. It's inactivated with formalin and adsorbed to an aluminum hydroxide adjuvant. This creates the vaccine. So I just wanted to cover the immunogenicity and efficacy of vaccines. Looking at immunogenicity, sorry, this word is difficult to say. In adults, it's been shown that more than 95% are seropositive after 1 dose, and nearly 100% are seropositive after 2 doses. And in children and adolescents, it's even higher, with 97% after 1 dose and 100% after 2 doses. Seropositive is just noting that the antibodies are in the body. So basically, it's extremely effective in getting antibodies into your body so you're able to fight off the virus. Havrix and Vacta have 2 examples of the efficacy of their vaccines. So Havrix looked at 40,000 Thai children, 1 to 16 years of age. The efficacy was 94%. Vacta, 1,000 children in New York from 2 to 16 years of age. The vaccine efficacy was 100%. So these are both well-known, well-used, very successful vaccines that establish antibodies in your body and allow you to fight off the virus. This is just an example of the vaccination schedules. Pediatric is the top half and adult is the bottom half. The volume is higher in adults, 1 milliliter, compared to pediatric, which is 0.5 milliliter. Havrix is the left, and then Vacta is the one on the right. This is just important. The doses are, you get the vaccine twice. Havrix, you get the initial, which you're supposed to get in the scheduled pediatric trials of immunization, and then you get the second 6 months later. Vacta can be extended up to 18 months later. Havrix can be extended up to 12 months later. However, it's important to get it, it's best to get it at that 6-month mark. But if you extend past the 12 or 18 months, you would have to restart the cycle of getting the vaccine. Contraindications and adverse reactions. So this is just to the vaccine itself. Hep A vaccine should not be administered to people with a history of severe allergy reaction to a component of the vaccine, or those also that have an acute response to the first immunization. When we're talking about pregnancy risk and vaccination, it's a theoretical low risk. The virus is inactivated, but there's no factual evidence on the safety. For immunocompromised, there are no special precautions needed, as once again the virus is inactivated. Adverse reactions have been shown. They're kind of consistent with most general vaccines. About 20% or to 50% of people have complained of pain, erythema, or swelling to the injection site, so a local reaction at the site of injection. There have also been systemic reactions, including onset of malaise and fatigue, reported by about 10% of the individuals that get vaccinated. No serious adverse reactions have been supported. So just to give you some recent life events, just to give a little context of hepatitis A, where we are now, once we had a virus, the cases decreased dramatically, but we still see hepatitis A in life, just in different amounts. So there was a frozen strawberry recall on October 30th in 2016. The agricultural distributors were required to notify all retailers that had received those frozen strawberries and recall them. In that situation, the CDC recommended post-exposure prophylaxis for those that were non-vaccinated, giving a Hep A vaccine for those that were ages 1 to 40, and then a Hep A virus-specific immunoglobulin for ages outside of that range. For that case specifically, there were 143 cases seen with 56 hospitalizations across 9 states. There were 0 deaths, which was very good. Another 2 cases, these are smaller, less talked about. There was a raw scallop situation that existed in 2016, August of 2016. 3 lots of raw scallops were actually delivered from the Philippines to California, Hawaii, and Nevada. They were able to quickly isolate the lots that were possibly tainted with hepatitis A and recall them. Lastly, there was a recall on blackberries. They were coming from Fresh Time Farmers Market and Woodman's Market. The investigation was actually completed in February 19, 2020. Went for about a year, or about half a year. Main amount of cases were seen in October of 2019. And this was found in states including Indiana, Pennsylvania, Michigan, Minnesota, Missouri, and Nebraska. In this situation, we had 11 hospitalizations, but 0 deaths once again. And with that, I have completed my presentation on hepatitis A. If you have any questions, feel free to email me. I put my email up here. Also, feel free to post on the discussion board. I hope you learned something about hepatitis A and can now understand one of the 5 hepatitis viruses that exist. And with that, here's my works cited. Awesome. Hope everyone has a great day.